Hey everybody, it's Dr. Sue from Synergy Chiropractic and Bodywork here in Austin, Texas. We're making for you guys a low back pain survival guide video series. This is video number 1. I've been having some low back pain for several months now, and over the past several weeks, I've been having radiating pain down the right leg. That means sitting, driving, brushing my teeth, putting on pants. There's been a lot of really challenging activities. And so I put this guide together for you guys to help you understand how do I get through my everyday activities without making my pain worse. Going to seek care and doing all the exercises the doc tells me. How do I in my day-to-day life not make it worse? All right, so step 1 is going to be getting in and out of a chair. We do this dozens and dozens of times a day, so this is a super important one. First part of getting out of a chair is actually learning how to use a hip hinge. You can get a dowel rod at the hardware store, or you can use a simple broomstick from your house. And what you're going to do is put it on the back of your head and the back of your behind, and you're going to learn how to bend those two things together. Okay, so what you're going to do is hip hinge. This is my pivot point. Instead of rounding from the low back, which we're used to doing here to pick something up, all right, we're going to use my hips and my head and my spine all as one unit. And so I'm going to bend like this. So my hips have to slide backward to keep my weight centered over my feet. Okay, but here I can bend forward, I can brush my teeth, I can get something out of the sink, or I can sit in the chair. If you're going to practice this sitting in a chair, make sure you've got this high enough that it's not going to hit the chair first. All right, so when I go to sit in a chair, make sure you've got your feet hip width. You're going to stand up nice and tall. I'm going to use my hip hinge, and I'm going to sit back into the chair like so. Okay, when I go to stand up out of the chair, I'm going to squeeze my glutes, lean forward from the waist. Notice my head or my low back don't come off of the dowel rod. I'm going to squeeze and come on up, and I can do that with no pain in my back or my leg. All right, if you don't have a rod and you're having some trouble with balance, you can put your arms out in front to act as a counterweight. So I can be here, and I can hinge and stand up and here. And sometimes it even helps to kind of imaginarily push yourself up with your arms like that. Okay, so that's our basic hip hinge. Second point of sitting in a chair, once you get down, is I want to sit my hips all the way to the back of the chair. You're going to see this is not a very well-built chair for sitting in for long periods. If I was going to sit in this for a long time, I'd want to put a roll here so that I could sit up nice and straight. And what I really want is to get my knees below my hips so I could also help with that curve. If I sit back like this, I'm going to eventually start slumping, and it's not going to feel good. Okay, so to get out of the chair, we're going to scooch to the edge, get your hips nice and wide. Don't be tempted to put your hands here around that back and push up. That makes my back hurt like crazy sauce. Okay, nice and tall, squeeze my glutes, counterweight arms if I need them, and stand up. Version 2 of getting in and out of a chair, just a front view so you can see the difference. I'm going to come to the front of the chair, get nice hip width on my feet. Remember that hip hinge. Sometimes when you're first learning the hip hinge, it helps to actually put your hands on your little points of your hips here and actually start pushing them backwards to start creating that tipping feeling, okay? But once you get the hang of that, you can have your hands up for balance, sit down nice and tall. When it's time to stand up, arms up, squeeze, and come on up, all right? Just that easy, no rounding, no slumping, no back pain when I stand. That's the best part. And that's how you get in and out of a chair.